Hello everyone, my name is Nurse Nikki. I am an LVN, also known as an LPN, which is a licensed vocational nurse. I am currently in school to get my ADN, which is my associate degree in nursing. Then I will get my RN and become a registered nurse. So today I'd like to share with you 8 tips that I have learned along the way between LVN school and RN school. This is stuff that I wish I had known just so that I would save myself a little bit of embarrassment. If that sounds interesting to you, go ahead and keep watching. So the first tip I have for you is gloves. Putting them on, easy enough. Taking off gloves. I see people so often take them off like this, touching under their own glove. That is not what you want to do. You do not want to touch your wrist with your dirty hand. I'm going to teach you the right way to do it. Just a minute. I should have brought my gloves out here. Okay, here we go. This is the proper way to remove your gloves. Please pay attention. Cup your hand, pinch the extra skin right here, and pull it off like that. Ball it up in your hand. Scoop under this one with your clean hand, and there you go. This goes in the trash. You know how often nurses wipe butts, touch blood stuff, mucus, all this stuff? You do not want to be wiping that on your skin. You don't know what kind of diseases these people have. Sometimes you have no idea. You do not want to end up with herpes wrist or something. I don't know. You don't want to touch it to your skin. So please remove your glove correctly. Anyways, number 2. This one is about the stethoscope direction. People will think the stethoscope goes on this way, but these are going in the direction towards the front. So not this way, if that makes sense. Yes. That is the proper way to put on a stethoscope. That one's nice and simple. It's pretty straightforward. Moving on. My number 3 tip for new nursing students is for giving shots. So when you have an alcohol prep, obviously you wipe down the skin before you give a shot. Let's say you're giving, I don't know, a flu shot or something. So you give it in the deltoid and you know all the right technique and everything. This is more for the patient comfort. I have found over the years of giving shots that if you wipe down with some pressure, you're putting a good amount of pressure while you're wiping. Let the alcohol dry so it doesn't burn them as much when you give them a shot. Administer the shot in the same place where you were wiping down kind of hard. It doesn't seem to hurt as much. I think this has to do with the gateway theory of pain, that your mind cannot really differentiate the pressure feeling versus the pain feeling. So the body is still thinking that there's pressure there. So when you apply the pain of the needle, they are still feeling the pressure. So I don't know. When people do shots to me like that, it doesn't seem to hurt as much. I get a lot of good feedback from when I've given shots. Take it as you will. Number 4. This one is so important, you guys. You have to know your normal vital sign ranges. You will always need to know the normal ranges. If a patient comes in, an adult male, 24 years old, and the BP is 210 over 183, okay, something's not right. Someone is about to just stroke out, keel over, something like that. Or maybe there's just a mechanical error with your blood pressure cuff. Maybe the blood pressure machine isn't working properly, the cuff isn't on just right, cuff isn't the right fit for that patient. You need to check these things and take it again. Do not write in their chart that their blood pressure is 210 over 183. Please God, do not write that and go about your day. The same thing goes for O2 sats. Here's another one. O2 sats, not stats, not stat. I need the stat. Sat, like saturation. Please don't embarrass yourself. I should put that, there should be 9 tips. Anyways, O2 sat is 64. Okay, that person's either struggling for breath, passed out, hypoxic, they are not doing well. If that person is talking to you just fine and having a nice conversation, not struggling for breath, the O2 device is not working properly, okay? Use your brain, make sure it's on their finger properly, readjust it, it's plugged in right. Sometimes you gotta unplug it, plug it back in, that's fine. Sometimes their hands are really cold. My voice cracked there. Okay, hold on. Where was I? Oh, sometimes their hands are too cold, so you just warm their finger with your nice warm hand for just give it like a minute, get some warm blood pumping through there, then reapply the O2 monitor onto their finger and it should be fine. So that was number 4. Make sure to check your equipment, know your normal ranges. All right, moving on to number 5. Number 5 is always introduce yourself to the patient. Let them know that you're a student nurse, that you'll be helping the nurse out today. A lot of people do these cheesy, like 2 for the price of 1, stupid things. Whatever makes the patient feel good in that moment, that's fine. But make sure you tell them that you're a student nurse, that you're there to help them. A lot of people are really receptive to student nurses and they'll want you to do stuff to them. Like, yeah, try IVs on me. Like those patients, thank you for those patients out there who act like that, who treat student nurses like actual people who are learning and gonna be the future of nurses eventually anyways. I'm on a rant. Why am I ranting? So introduce yourself, and every time you do something with that patient, make sure to explain to them what you are doing. This not only helps you verbalize out loud what you're doing so you know what you're doing, and it'll reassure them so that they don't have fears about a student poking them with stuff. This will make it more likely for them to be receptive of the care that you're going to be giving them. This leads to our next tip, which is thicken your skin. I know it sounds sad, but people are going to be mean. People are going to say terrible things to you eventually. Not everyone is going to be happy to be poked and prodded by a student or a new nurse, but it's important to not take that personally. These people are scared, they're in pain, they're confused. As a nurse, you are there to heal them. They are not feeling well, and they're not always going to say the kindest things to you. Okay? Do not take that personally. Just let these agitated patients know that you were there to facilitate their recovery. You were only there to help, and you're doing the best that you can. A lot of times people will realize that they're being rude, or yeah, maybe they shouldn't have said something like that, and they might calm back down. All right, and that one brings us to number 7, which is do not trap yourself in a room with a combative patient. This is pretty easy and common sense. This is for patients who have been known to hit, yell at nurses on some kind of drug. You don't know what they're on. Like, just do not leave yourself in that situation. The best way to avoid trapping yourself in a room with a patient like this is to stand at the doorway when you're caring for this patient. Do not get on the other side of the room or on the bed. You want to make the easiest exit possible in case things go south. Your safety will always be a priority. If you are not safe, the patient will not be safe either. Number 8, this is the final one and very, very important for becoming a better nurse as a nursing student. When you go to clinical, a lot of people are shy, they don't know what to do, they don't know when to ask, like, hey, can I do that? Always ask. Always ask. If you see someone doing urinary catheter, an IV insertion, an IV DC, anything like that, you want to do that. You need to tell them, hey, I've checked off on skills for this, can I go ahead and do that? And you watch me. 99.9% of the time, they're gonna say yes. It is the way of nursing. This is what clinicals are for. Do not be afraid. If you do something wrong, this is the time to do it when you're a student, so you don't get out on the floor getting paid and liable for all this stuff. Later on, when you're an actual nurse, you have the skills and the failures now in school. All right, well, I hope you enjoyed the video today. That is my 8 tips for new nursing students. I hope you found it educational. Maybe you've been a little bit nervous about school. Now you have a few things that you know that you can do better, that you can try harder at to become a better nursing student. If you enjoyed this video, go ahead and subscribe down below and hit that like button. I don't know why, but YouTubers say it, so it must be for something. I'll see you guys next time.
Herpes risk.